So crowns and bridges really are for tooth replacement. So if you're missing a tooth, we can do a bridge, which is essentially 2 crowns on either side of the missing space and a crown fused in between. And those work really well. For the longest time, that was kind of the Cadillac. That was the best you could do. Now with the invention of dental implants, I still do a fair amount of bridges. They're more cost effective and the process is quicker. So most patients don't want to wait 6 months for their implant to heal and then have the crown placed on it. A lot of people society today want it now, want it 5 minutes ago. So a bridge really is kind of that quick way to be able to get a tooth in there and fix the concern. As far as the crown goes, when a tooth is badly broken down or if it breaks, if a big piece of it breaks away, especially around an old filling, we do a crown to keep the tooth whole. It kind of acts like a force field over the tooth, so when you bite down, all that force is kind of dissipated away from the areas that could possibly crack and protect the tooth. It keeps it whole, it keeps the tooth in your mouth and prevents it from possibly breaking into the root system, in which case the tooth would have to come out. Procedure's just as simple as a filling, and in fact, sometimes more simple, because all I really do is get the tooth ready for the crown. We remove a little bit of tooth structure where we need to, and we take an impression. Whether that's a digital impression or whether that's an actual goop impression will kind of be determined by the situation. And at this point in time, we send it to a lab technician and he does everything, whether it's porcelain, zirconia, or gold. Comes back 2 weeks later and we cement it in your mouth.